We'll start from deltoid muscle, okay? I told you deltoid muscle, right? Deltoid muscle is supplied by which nerve? Deltoid muscle is supplied by axillary nerve. Axillary nerve supply only two muscles in our body, the deltoid and teres minor. Okay, here deltoid muscle. So, you know IM injection, right? IM injection, where they are taking? We are taking on the lower part of deltoid muscle. IM injection are taken. Intramuscular injection. Injection are taken on lower part of deltoid muscle just above insertion. Okay, so this is asked where the deltoid muscle just above insertion. Okay, the other point is it is supplied by which nerve? Axillary nerve. Okay, we already discussed it. Axillary nerve supply it. Okay, the other important point is this deltoid muscle helps in all movement of shoulder. Okay, deltoid muscle helps in all movements except what? Except adduction. Okay, except adduction. This is very important. This deltoid muscle is known as deltoid muscle is the abductor of shoulder body, the main abductor of shoulder joint, main abductor of shoulder. Okay, so if MCQ comes, which is a main abductor of shoulder, which muscle is deltoid. So it doesn't do the movement adduction. What is adduction? Towards body, right? Abduction means away from the body. So this abduction is done by the deltoid. There is no adduction. Okay, so this is the abductor. So if they give adduction, there is no function of adduction for deltoid muscle. So keep in mind this. This is very important. There is no adduction. It is the abductor of shoulder. Clear? Yes. Okay. Now we'll go for muscles of pectoral region. Okay. Muscles of pectoral region. Which is our pectoral region? This is our pectoral region. Now we will study the muscles present here in the pectoral region. Okay. The muscles of pectoral region. What are the muscles? One is pectoralis major. If there is major, there must be what? Minor. Pectoralis minor. Pectoralis major and pectoralis minor. Not major again. Pectoralis minor. And third one is there is a muscle known as subclavius. Sub means below, right? Yeah. Subclavius. Then we have the important muscle, that is serratus anterior. Serratus anterior. Okay. This pectoralis major and minor, they are supplied by lateral and medial pectoral nerve. Okay. They are supplied by lateral and medial pectoral nerve. Keep in mind this. We'll discuss it later. There is some important. This is a hybrid muscle. Okay. So we'll discuss it later. This is supplied by lateral and medial pectoral nerve. The pectoralis major and minor. This subclavius is supplied by nerve to subclavius. What? Nerve to subclavius. Okay. Serratus anterior is supplied by nerve to the serratus anterior. Nerve to serratus anterior. Nerve to serratus anterior. Okay. This nerve to serratus anterior, it is known as the long thoracic nerve. Long thoracic nerve, or it is also known as Bell's nerve. Okay. So these are the muscles of pectoral region. Pectoralis major, minor, subclavius and serratus anterior. Major and minor are supplied by lateral and medial pectoral nerve. Subclavius is supplied by the nerve to subclavius. Easy to remember. Serratus anterior. You have to remember this one. The long thoracic nerve. It is very important. The nerve to serratus anterior is known as long thoracic nerve or Bell's nerve. Clear? Now we will study the serratus anterior. This muscle is very important. Clear, right? Till here clear? This serratus anterior. The serratus anterior is also known as climbing muscle. Sorry, not climbing muscle. This muscle is known as boxer's muscle. Okay, boxer's muscle. So which is the boxer's muscle? That is serratus anterior. We studied the insertion of serratus anterior. I told you this muscle is having digitation, 8 digitations. So origin is from 8 upper ribs, okay? Because their digitations are starting from 8 upper lips, okay? Origin from 8 upper lips. Insertion I already explained you. The ventral or costal surface of scapula, okay? We studied in scapula, ventral or costal surface of scapula. There is an important clinical pathology, that is any injury to this which nerve supplying the serratus anterior? The long thoracic nerve, right? Long thoracic nerve. So any injury in long thoracic nerve, any injury here, any injury to this nerve cause a condition known as winging of scapula. Winging of scapula, from the word winging, right? Scapula, there will be winging of scapula. I will explain you, I will show you from the book Chalusia how it is. So it is, this condition is known as winging of scapula. So winging of scapula is due to injury to the long thoracic nerve, okay? There is damage in serratus anterior muscle or boxer's muscle, okay? The other muscle was the pectoralis minor. Pectoralis minor. This muscle is originating from the 3rd, 4th, 5th costochondral surface, okay? From the 3rd, 4th, 5th costochondral surface. What is costochondral surface? Costo means what? Rib, right? Chondro means cartilage. So rib will be connected to the sternum with the help of cartilage. So there is a surface known as costochondral surface. So this pectoralis minor is originating from the 3rd, 4th and 5th costochondral surface. And these are inserted. These are origin, okay? This is the origin of, this is origin. I am talking about origin. Insertion is in, I already explained you where is the insertion. That is superior surface of coracoid process. We have already studied this. So pectoralis minor originating from the 3rd, 4th, 5th costochondral surface, and insertion is in the superior surface of coracoid process. Clear? So this is all about the muscles of pectoral region.